welcome back to another episode of Dr. N. Today we will be discussing men's fertility and erectile dysfunction. We have two of our great physicians, Dr. Omar Rahim. He's one of our consultant urologists and he's specialized in men's health. We have Dr. Khalid Al-Baba. He's one of our endocrinologists, and myself, Dr. Safa Hegazin. I'm a consultant in internal medicine and obesity medicine. Welcome.
Thank you.
Thank you.
Thank you. Dr. Omar, tell us, what do you think the prevalence of erectile dysfunction in this area, and what is exactly the definition of erectile dysfunction?
Well, first of all, thank you, Dr. Safa, for this nice invitation to speak to our patients. This ties up really nicely with our November, which is the month of November coming up to highlight the men's health role we do to our patients and to improve their quality of life. I think men's health is obviously a huge topic. I think erectile dysfunction and infertility fall under this category. Usually, the erectile dysfunction is defined by men unable to perform sexually, is unable to sustain or even maintaining their erections, to have a full sexual intercourse. Unfortunately, this problem is common in our men across the age group, from the younger age to the older ages of men. And the causes of it, obviously, there's a number of causes that can be organic, hormonal, medication induced, as well as maybe it's even psychological. So I think we see a lot of men coming to our clinics with this problem. There is obviously a very standard evaluation treatment for these conditions, and that help men improve their quality of life.
Definitely. It's definitely a complex disease. And sometimes I feel the patients are not really encouraged to open that discussion with their physicians. Sometimes it's a problem of them to open and start discussing that with their physician. So there's a lot of barriers, social barriers, I feel. If someone present to you today with erectile dysfunction, how would you manage them and treat them?
I agree with you. And just to comment on your last question about how important and how sensitive topic is. It's almost like it carries a stigma for our men. Oftentimes, patients come to see me in my clinic here at Clinic Abu Dhabi, and they was told by his wife or told by his loved one to come and seek the advice or medical advice for erectile dysfunction. So it's a really important topic for men. Our doors are always open to welcome them. We act as a gatekeepers for them. We tell them to get in to see us, because erectile dysfunction could be a surrogate or a biological marker for other medical problems. We're going to talk about it shortly. I think for me, specifically, when they come to me to seek medical advice, I will start with a good medical history for them. I will review their medications, do some basic evaluation for them, which include also testosterone levels, as well as other metabolic markers in the bloodstream, as well as do more specific penile evaluation, which include an ultrasound, for example, to evaluate their functionality, how good they are, and there are different ways of doing that. And from there on, obviously, we have to provide them with the best treatment.
Right. Okay, very good. Thank you. Dr. Khalid, can you touch base a little bit on the hormonal causes and metabolic causes of erectile dysfunction?
So as Dr. Omar said, it's a common symptom or condition, and many times the patient would not address it himself. So usually in our clinic, we ask the patient if he has any symptoms of erectile dysfunction, if he feels any symptoms of decreased libido, because that might highlight us to do some workup to check for any endocrinological cause. Usually the most common cause is decrease in the function of the pituitary gland or the testicles that usually produce hormones. So the pituitary gland is the gland that stimulates the gonads to produce testosterone and hormones. Usually do blood tests to check for this. Sometimes we do some imaging. We usually combine the care with the urology clinic or with the men's health clinic. Many times we share the management of the patient. Most of the conditions are treated by medication that replace the missing hormone or the hormone that's not being secreted enough in the blood. Another important cause is the uncontrolled diabetes or poor diabetes control, which is also very common in this area, because diabetes can affect the vascular function of the human body, and Many complications can arise from poorly controlled diabetes, including eye complications, heart complications, and also definitely erectile dysfunction and sometimes fertility issues with the patient. And in our clinic, definitely we try to achieve normal diabetes control for these patients. This includes, of course, using medication, but also using healthy lifestyle conditions, including exercise and diet. That's why also your clinic and obesity clinic also we share care with these patients for diabetes, for proper diabetes control.
Definitely. That's why in Cleveland Clinic Abu Dhabi, we like that we have this multidisciplinary approach to these patients. Like we said, it's a very complex disease. I do get a lot of referrals for weight management. And I just want to highlight obesity does affect the production of these hormones. So that connection that you mentioned between the hormone that's secreted from the brain to the testicles get disrupted. And so we see these patients with obesity, they have low testosterone, they have more of the female hormones like the estrogen, estradiol is a little bit higher than we want it for them. Also, we've noticed that, of course, obesity, especially abdominal obesity, it's related to low sperm production and low function and quality of these sperms. So they do have erectile dysfunction and they do have infertility as well. And from the study, we've seen that the weight loss actually helps with the testosterone level. So this is one thing we definitely try to help patients with. Lifestyle is very important, like you mentioned. Sleep, I feel like here we underestimate sleep. Studies have, I don't know if you guys know, but there's a study that showed if consistently they sleep less than 5 hours, the size of the testicle is smaller than other men who sleep more. So sleep, stress, physical activity, it's all important. And we use medications to help with weight loss. So from these medications today, the GLP-1s that I use or the injectables, like we know, semaglutide or the name of Ozempic or Wegovy, I guess you use them in the clinic too. And the other one is Mounjaro or tirzepatide. And there has been studies that actually improve fertility, improve sperm production. Prelim studies, of course. It's not like there's no randomized controlled trials yet. But it does not affect fertility in a negative way. If it does, it would be in a positive way because it helps with the weight loss. And I think this is how we approach the patient in a holistic approach.
Absolutely, I agree with all that you said, and I'd love to back up this with evidence as well. As the studies are being proven that weight loss can actually improve testosterone, but also vice versa. I see the opposite is also true. Having patients with low testosterone, if you replace testosterone, they can also get motivated, more energetic to lose weight. And there's multiple studies across the world who kind of show that diabetes also can be controlled better with men who has a normal testosterone levels and with testosterone. So it could be not only metabolically the patient can be improved, but also hormonally and also sexually.
And quality of life overall.
Absolutely.
Yes, definitely.
So in addition to medications, we also have the diabetes educators who also help in controlling diabetes. Dietitians and the dieter is a very important diet to control these, to prevent what we call metabolic syndrome or to improve insulin sensitivity. I just want to ask if there is any special procedures in the urology clinic that you do to improve the men's health and improve erectile dysfunction after we control blood sugar, after we reduce weight.
Absolutely, and this is a great question, Khalid. I think we often get asked from our patients, what can you offer me to improve my quality of erections, for example. I think I can tell you that number one and at the forefront of everything is to lifestyle. I think you mentioned lifestyle, weight loss. We strive to lower our weight, improve our metabolic performance, diabetes control, and so forth. And because those actually will tie up nicely to the endothelial function. If you improve those metabolic markers, your blood flow will improve. In other words, your endothelial function will improve. You're going to improve better. You're going to feel better, obviously, and also you're going to improve your erectile function. Beyond that, obviously, there are some drugs we can give. This is very commonly available: Cialis, Viagra, and Levitra. These are commonly available drugs. under the family of penile erectile dysfunction medications, and then given with a prescription, obviously. And then there are injectable therapies, and then from there on, there's novel therapies like the shock waves and then PRPs and the
Yeah.
P shots and stem cells, which is considered to be more like a regenerative therapies. Oftentimes, the patient really exhausted all those options for erectile dysfunction, and we have done a full evaluation. There's always an option for prosthetics, and that can be helpful for those men. Those men who really wants to restore their erections even better, and not depending on medications, we come in as a specialty to help them. And these are minimally invasive procedures that help them really restore erections, well, with very minimum side effects.
Yeah, I agree. So I think it's a multidisciplinary
Definitely.
approach, definitely improving the metabolic medium of the patient, healthy lifestyle modifications, controlling blood sugar, and blood pressure, cholesterol, all helps in improving men's health, definitely.
Yes, for sure. I think the message we want to say, if you have that issue, make sure that you open it up in a discussion with your physician, because he can definitely help. There is a lot of modality that we can use, and definitely, again, a multidisciplinary approach is the appropriate approach for this complex disease.
I agree.
Absolutely.
Definitely.
I want to really add one thing about the infertility. I think you touched on it, Dr. Safa. I think infertility, couples cannot be able to conceive. I think that an area that between urology and endocrine and diabetes, I think having better control for diabetes, I think, is going to improve your sperm function. And this has been multiple studies proving that diabetic men, they have poorer outcomes, poorer fertility outcomes and reproductive outcomes. So again, it ties up nicely with the testosterone, erectile function, but also fertility. So if you're diabetic, you really get checked, control your diabetes, because that will ultimately help you produce better sperm for your wife to conceive naturally.
Definitely, yes.
I
yes.
agree.
Okay. Well, thank you all for
Thank you.
this
Thank you,
great
Dr. Safa.
discussion, and for more to come, hopefully.
Hopefully.
Thank you.
Hopefully, yeah, absolutely.
Thank
Thank you
you.
very much.
Thank you.